Hello and welcome to the Future of Dogs podcast, a place for the whole dog world to come together and ask the big why and what if questions that will shape the dogs of the future. Join me, Hannah Malloy, dog behaviourist and body language expert, as we chat to some of the world's most groundbreaking professionals intent on enriching and evolving the future for dogs. This series is sponsored by Amplified Behaviour, my online video school where you can find quality dog behaviour and training advice at a fraction of the price, because I believe everyone should be able to afford the knowledge that they need to give their dogs the best life possible. Let's jump in to the next episode. Hello dog fans. Gosh, it's good to have you back with us for another star-studded episode of The Future of Dogs. This episode is the future of dog health, part 1, and have I got a buy one, get one free of brains and beauty sitting in front of me that is about to blow your minds. I have to say, I have so enjoyed season 2 so far. This is our Responsible Dog Ownership special series, and we are digging into some really important topics that all dog owners need to get a handle on that are undoubtedly going to revolutionise dog life for each of us and for our four-legged friends too. Our next guests are radical educators in the realm of dog health, and they're going to teach us all about preventing and curing pain conditions in dogs. So do say hello right now, down your radio, to Julia Robertson and Dr. Hannah Capon. Hey, ladies.
Hello. Thank you for inviting us. Yeah.
It's so good to have you both here, honestly. It really is like such an exciting smorgasbord of brains, the two of you, because I know, Julia, I'm going to read your bio in a minute and it's amazing, but you have been in the field of, you know, building puppies and talking about how to put dogs together for such a long time, haven't you? And I know, Hannah, you have just your career is just going skyrocketing right now, and it's amazing to even get 5 minutes of your time, to be honest with you. You're jet setting all over the place. It's wonderful. Julia Robertson is the founder and global head of the Galen Myotherapy organisation. It was established in 2002, and Julia was one of the very first in the UK to treat and understand the effects of adaptive change or muscular compensation in dogs. And since 2002, Julia has worked tirelessly to improve dogs' lives and their health. In this time, she's treated over 8,000 dogs and trained hundreds of people in Galen myotherapy techniques. She is considered an expert, a pioneer and a leader in her field of canine myotherapy, both in the UK and worldwide. And this is reflected in the number of national and international invitations to both speak and teach. In the last 4 years, she's travelled to 12 different countries and made 29 international appearances. She's been spreading the knowledge and helping dogs across continents. She's an expert within this modality, and she's developed Positive Pact, PACT, which is a registered trademark of Galen's unique methodology. And it's choice-led treatment, which is revolutionary when working with animals that are in pain. It's been formed from her extensive experience and observations over her years of practice. And she was also one of the first to bring the correlation between canine pain and behaviour to the public's awareness, which is bonkers, isn't it? We should have thought about this a long time ago. Yep. This has now been formalised into the Galen Comfort Scale, which is being used in the many studies and treatments that Galen are involved in. In 2019, the first Galen Myotherapy International School was launched in Oslo in Norway, which was quickly followed by the launch of a second school in Melbourne in Australia. In 2019, she also saw the transition of the Galen Canine Myotherapy Diploma into Spanish, awesome, providing greater accessibility to the course worldwide. And over the years, Julia has met and made some truly amazing associates, luminaries in their field, who work closely with her and with the development of the Galen Myotherapy organisation. She's published 3 books, one of which I am wielding right now, and I absolutely love, How to Build a Puppy. And she's done lots of DVDs too, Tongue to Tail, which was the winner of the coveted US Maxwell Award from the Dog Writers Association in America in 2012. And she founded the charity War Dogs Remembered in 2015 too. And that charity was set up to pay tribute and raise awareness of all the dogs that have served in the military, and especially the pet dogs that have contributed to the Great War and the Second World War. Super amazing work, Julia. It is so amazing to have you with us today. Thank you.
Thank you. I think I'm to edit down that bio a bit.
Don't do it. Why would you do that? It was absolutely outstanding. All of that needs mention as far as I'm concerned.
Should we get a new Zoom screen? I think her head's just got a bit...
No, it really hasn't.
Listen, if you've done the work, I think we should talk about it. As simple as that. It's not easy to write your own bio. Okay, Hannah, it's your turn. It's as simple as that.
Mine's 3 sentences.
She's a busy
I'll go off
girl.
and make coffee.
No. Stick with it, Julia. It's not going to be long.
Are you ready? Are you ready? Okay. Dr. Hannah Capon, first of all, doctorate. So love that. Takes a long time to get a doctorate. Who has time to write a bio? Dr. Hannah Capon is an experienced veterinarian. She's an award-winning online educator and an international speaker. She continues to work in first opinion practice with a special interest in chronic pain management, specifically osteoarthritis in canines. She has been awarded the Chris Lawrence Vet of the Year, the Royal College of Veterinary Surgeons Impact Award, and she's recently been presented with the World Small Animal Veterinary Association's Companion Animal Welfare Award for her tireless work on canine arthritis management, an online education resource for both dog owners and professionals. Her area of interest is maximising the vet client-patient relationship in osteoarthritis management to achieve optimal multimodal management plans, which I think I should get an award for saying, if I'm honest with you. Hannah, it is so great to have you with us too.
Thank you for having me.
So you guys have known each other for quite some time, right?
Too long.
I could feel the vibe. When you both arrived in the room, I was like, you guys have been around the block. How did you start working together?
Oh, well, it's 2015 or something, wasn't it, when we first...
No, I think it was before that, 2014. I think it was, yeah.
Yeah, it's quite a sort of funny story, really. I mean, you can pick it up from your perspective, but I know...
Well, when you say it, I'll keep butting in and telling the truth.
Okay. I think I started treating one of your veterinary nurses' dogs. Is that right? Or your practice managers?
Yeah, we had a receptionist called Sheila, and she was one of those prickly receptionists that said what she thought and smoked 40 Marlboro a day. She spent more time outside the practice than she did inside. She was like this quite sinewy, opinionated woman, and she had one of those little Suzuki wagons, and she'd arrive with her dogs on the passenger seat and her, and they're a tiny little parcel van, around the corner like Postman Pat. And she turned up one day, and I swear to God, she went, "My dog's legs are facing the right direction again." And I was like, "Oh, shut up, Sheila." "I don't know what you're talking about." She said, "Well, no, they were facing the other way yesterday, and I went to see somebody, and they're facing the right way now." And I was like, "Shut up." So I entertained sinewy Sheila. I was like, "What do you mean you've been to see a lady and the dog's legs are now facing the right direction?"
And had a magic wand.
She just said she'd met this lady who treated her dogs and they used to face outwards and they now were facing the right direction, and she thinks it's amazing. So because I was intrigued about somebody that can make people's legs, the dog's legs, face the right direction.
Come on, this is what we want. Vets who are like, interesting.
Interesting.
I'm curious.
Yeah, well, I'd already got a little bit of an interest in pain because I just realised we did it so badly. I just was like awestruck at how awful the attitude to kind of like, well, chronic pain, OA, musculoskeletal, all these kind of forms of chronic pain. Oh, it is what it is, Hannah. They've got to die of something. What?
Oh my gosh, what a terrible.
So I was already on a quest to try and find how I could learn more, because at that point there really wasn't very much in the vet sector. So I went to find a lady who could make dogs' legs face the right direction.
Well, you phoned me first of all and said, tell me about what you do. How do you practice? What is it you exactly do? So I told her it's myotherapy and work on soft tissue, compensatory. And she went, "Oh, I better come and see then, hadn't I?" I went, "Oh, okay." So you brought Holly, didn't you, Hannah?
I did. And I came and... Did you actually treat her the first time, or did I watch you treating others?
No, I think you watched me treating others, and then you brought her in for me to meet, and we just had a chat. And I thought, oh, I wish my vet was as cool as this one, because she had a tattoo. I remember that. I remember that really, really. I know. That's all I remembered about meeting you. Nothing else.
She's so cool. She's just
that really makes me feel small.
When I first met Hannah Capon, I was like, I need to up my eyeshadow game in a big way. I was like, this girl's like got eyes like the universe, and I'm gonna.
When I go mad with my blue?
It's like, wow. I was like, it was bright. I was like, all I can see is your eyes, and it's the only thing in the room. So
being a vet can be quite boring, in fact. So I went through a phase of wearing really ridiculous eyeshadow to work, just so I could be a little bit different. Anyway, back to the phone call.
Then you came, and then you went, obviously, because you did. But then you rang me, or something happened. You said, "Can I come and see what you do again?" And then you signed on the course, didn't you? You said, "I better do this." And it was this great enthusiasm that you employed. Well, I suppose I better. And that was it, really. You joined the diploma course, didn't you? And
I think I stared at you a lot with angry eyes, though. Don't you remember?
Ever since you have, always. You just say how much you hate me all the time. All the time.
Because you ruined my life.
Opened your eyes, is it? Is that it? It's changed the trajectory.
She ruined my life. I was a party girl. I was having a great time. I kite surfed, I drank beer, and I had a really, really fun existence. Then she kind of opens the doorway. I felt compelled to do more. Suddenly, I'm boring. All I do is work, and it's your fault.
Oh,
well, fair. I think the dogs are thanking me, so you may not, but the dogs are. So I'll take that,
isn't it? This is
I'll take that. Yeah.
And that's the hard thing, isn't it? Once you start to see something that you haven't seen before. I know when I teach people about body language, and I'm like, let's just observe this dog as it's walking on the lead. Like, can you see the tension in its body with the lead tense versus like loose the lead for a bit? Now look at the body, and they're like, and suddenly everyone's like, I can't stop seeing dogs on tight leads. And I'm like, I know, it's ruining lives. Like, it's really hard to not see.
As you say, once you teach it or just facilitate people seeing something, they can't unsee it. It's just like posture too. The moment you start seeing bad posture or bad movement, you cannot unsee it. Or the other thing that I know,
immediately posture corrected. I was like,
exactly. And it's like when you used to have this joy of just stroking dogs and just watching them walking around, whatever. And now you feel them go, oh. And it's a bit sad, really, because suddenly you see things completely differently. But then again, it's also good because
super important.
Well, I'm going to tell you, actually, Julia unintentionally pushed me into a very dark place. Do you remember?
Which
I am. She pushed me into a really dark place.
Big hole. It was awful. Yeah, big hole. Couldn't get out.
Because exactly that.
When I locked you in the room and said you're not coming out until.
That's it. You will become a consultant for me. That's it. Yeah. No, so once you start seeing the ghosts of the dogs that don't have the lives that they deserve, and then it spreads to. So for me, I went on quite a dark journey where I then started thinking, well, if I'm trying to help dogs, then I need to help other animals. And actually, if I'm going to help other animals, I've got to be really aware about what they go through. So I'm not going to eat meat anymore. I'm not going to eat any dairy product. Right? I'm going plant-based. And then it starts kind of going into, well, if I care about animals that much, then I've got to care about the environment. Oh my God, everything I do defeats the environment. So it got to one point where nothing was pleasurable. Because being a human, when you start thinking about the influence that we have on the world that we live in and the animals that live with us. And it was kind of like, get a check-in on this, Hannah, because this could go
quite a spiral, that, isn't it?
It's a terrible spiral because, as you say, you start seeing ghosts. You start realising that the animals that we say we love quite often are under our noses and suffering. And that's very difficult, especially in vet work. you've got a caregiver that comes in for, be it a health check or be it a lump. They come in for a lump, and you look and go, oh God, the dog's broken. And then completely unaware that that dog is suffering in their great care. And that's really difficult, isn't it? Because those people do not realise that their dog is not having the best of lives. They really do think they are having the best of lives. So that's why we wrote the film Suffer in Silence, because, they are, sadly, many.
Yeah. You see different people, if you see what I mean. But sometimes it's the same people, but people that come to us for treatment are people that are really engaged and really perhaps still are doing things that they could improve, but they're willing set of ears generally. They really want to know, which is a very different conversation to some of those very difficult conversations that you have to have as first opinion. Really difficult. And I don't envy you those, because it is very difficult. Some of our conversations we have, even things like, look, do you realize the importance of not having slippery floors and just putting rugs down and not doing all this repetitive stuff? We've got a small amount that we need to focus on, but you guys, you've got so much that you have to cover. It's really difficult. Communication, well, we've talked about this a lot, haven't we? Communication is something that us humans are meant to be so good at, and it's one of our worst things, isn't it, really? It's really, really difficult.
And it's permission, I think, as well, isn't it? I know, I'm sure, Hannah, it's the same for you. If I get a dog into surgery and the client has brought them to me for a reason, and they've brought me to usually for one reason, and they're like, this is the problem that we're having. And I look at the whole circumstance and I go, actually, there are other areas of welfare that you really need to start with to improve in order to be able to get to change that particular behaviour that you're focused on. And I'm sure it's the same for the dog's body. And it's like, how much do you want to know? How much time have we got? How much resource have we got to fix this problem? And like, actually, what's the capacity of the person in front of me to be able to lovingly hold that well? Because for most people, they're like, please don't tell me. Like, that's exactly it. It's like, how much can I do about that? There's not a lot I can do. This is my work pattern. This is the food that I can afford to feed my dog. This is the help that I've got around me, to love my dog well. And that is really difficult to kind of pitch that and say, have I got permission to open that up? But
without leaving guilt.
Yeah, exactly. Or shame. Get rid of shame. There's no point in it.
Absolutely.
I always said to my trainers, if you have improved that dog's welfare by 1%, you've done a good job. That's amazing. Absolutely. It was better than it was yesterday. You can't do everything.
Completely.
And so for you ladies, let's bring this back. You've got such a huge wealth of experience and knowledge, and I just want to bring it down to our sort of top of the pops. If you were going to sort of name your top 3 maybe issues that you regularly see that most people don't kind of pick up on in dogs, what would you say they are? You can by all means choose different ones each, or I'll be interested to see if they're the same.
Do you want to alternate? Go, Julia. You do first one.
Okay. Well, I think the first one for me, without doubt, is instability, physical instability. That's huge.
And how would that present? So that's just a dog that like isn't stable on its feet. Is that what you're talking about?
It's sort of the dog. It comes back to puppies and the development. It's built from the outside in rather than the inside out. So the joints aren't stable. So you've got this dog that's performing all sorts of even everyday stuff on a body that has not really been pulled together to work as one. And that can go on to create all sorts of secondary things.
Is that a bit like with humans? Every practitioner's like, you need stronger core. And that's why your back is weird, or your legs are odd, or your neck is pointing in the wrong direction because you need better core. You're picking up things in a stupid way because you're not tensing your core muscles. Would that be the same?
Sort of the same. I mean, core now, we don't look at the core as much as more of the whole body because, of course, we are completely connected from toe to feet or feet to toe or hands right the way through. So we're connected all the way through to make all these wonderful functional movements. And if those connections aren't made properly, especially as a puppy, then we become, or the dog becomes, or we become unstable. And of course, a lot of what we do is exactly what we're doing now, is sitting in front of a computer, which for younger children, when they are developing, like puppies and adolescents, they're developing the wrong patterns, which then goes on to create this instability within the body. So these patterns that are meant to hold the joints firmly but flexibly within the body don't. And then that creates all sorts of other compensatory issues. And then it can just have a global effect on the body.
Fascinating.
And that would be my number one. And I don't want to keep coming back to the puppy book, but that's why.
Yeah.
Because that, I believe, anecdotally, for what I've seen, just can go on and on and on. Because if they're not stable, then they can have more prone to accidents and then more prone to repetitive strains because they are loading asymmetrically and all of those sorts of things.
Okay. Wow. Okay. So instability, number one, definitely. That is fascinating. What would you say is number two, Hannah?
How bad can I be? Can I really set the cat amongst the pigeons?
Dude, you can do whatever you want, Hannah. Crack on.
All right, then. I think a massive problem is that we're not talking about breed predispositions and innate health. And I'm a bit stunned and sickened by it. I had a year off clinical practice whilst working on CAM. And when you go back into the consult room and you see French Bulldog after French Bulldog, after Pug, after Daxi, after Cavapoo, and you just sit there thinking, do people have a real understanding of how these breeds are very likely to have a shortened life and a life of suffering?
And
that's awful.
And
that's
the answer is no,
eh?
Actually. No, it's not harsh at all. It's brilliant, Hannah. And actually, we have a 2-part episode with Dan O'Neill and Rowena Packer, and we unpack all of this about extreme conformation and innate health. So absolutely, it's top of the pops. In fact, if you are following this current podcast series, The Future of Dog Health, this is part 1. But to really look into dog health, we need to think about breeding. So Hannah's bang on. And if you haven't listened to any of the previous episodes on the future of dog breeding, I would go back right now and start listening to those because they are super important. But
they're amazing speakers. Rowena and Daniel are amazing. And it was quite funny because I went back into practice because I messaged Dan a fair bit. He's like my uncle. I love him. And I was saying to him, I'm practicing like the shit sandwich approach. Sorry, shit. But
fine.
And I'm trying to work out how to speak to the clients in the consult room where they've come in, and it might be a health check or it might be a complaint, and trying to bring to their awareness that this was expected, you know, and trying to do it in a way that you don't create guilt, shame, confrontation.
Yeah.
You don't get them to switch off. I'd love to do a lot more work on communication, as Julia was saying, is because we've got to start having these conversations, and we're shying away from them because at the moment they come across as being told off or shaming. But if we don't say to people, your French Bulldog at the age of 2 is already really struggling, I would encourage you not to be, drawn to this breed again, for example. If we don't, it's just going to perpetuate, isn't it?
And just for the sake of those that haven't listened to those breeding episodes, can you just give us quickly, before we move on to our number 3, Hannah, can you give us what are the top shelf issues that you find with dogs that come in with extreme conformation? What are the kinds of sicknesses that they have? Because I think for some people that is a real shock, and they're like, what? I didn't know that French Bulldogs would get sick, with Dachshunds. Like, there's loads of Dachshunds, they're everywhere. How could they possibly get sick? What kinds of sicknesses are we talking about?
So we kind of start at the front. We've got sheer dyspnea, which means difficulty breathing, and people now normalize the fact that they're and I'm really sorry, that's a sign of I'm not managing to ventilate myself sufficiently. And that then leads them to struggle to exercise, to play, to have the life that we want them to have, that independent, fun mobility. They're really prone to hypothermia. So then, really restricting what temperatures they can go out. You've got the fat face. So they end up having a lot of eye problems as well, and corneal ulceration. Can you imagine having a corneal ulcer for much of your life?
Gosh.
No, you couldn't. Moving back, let's talk about so esophagitis. So quite a lot of them, they have regurg. So they end up having what we'd call acid kind of like reflux. So that's another thing. Then you've got your spinal anomalies. Many of them got transitional vertebrae between their thoracic and lumbar spine. Many of them have like hip dysplasia. So when you kind of start looking at it, you think, crikey. And I'm going to be really outrageous. I was with my friend Emma Milne, and we're at Shanghai, and we're at the WASAVA conference, which is the World Small Veterinary Association. And she had the podium to talk about, breed to a global audience. And we've got many countries that are coming up the rear with pet industry. They're really, like the Chinese, for example, it's the biggest growth market over there in China.
Amazing.
And you want to kind of go, don't make the mistakes that we've made.
Yeah.
Learn from lessons from us. So she had the podium and the room was empty. We had probably about 20, 30 people. And as her lecture was coming to the end, talking about brachycephalics and, innate health and stuff, the room started to fill before she'd even finished her lecture, because the next one was surgical correction of the brachycephalic.
Great.
And I was just like,
Tricky.
I can't blame the veterinarians of the future for being interested in being on the shop floor and being equipped with the tools to remedy it. But it would be really lovely if there was also the same interest of how do we prevent it. So that was, sorry, a bit around.
No, that's huge and important. And also, the behavioural aspects. I know I met Emma Milne at the Norwegian symposium for dog breeding, and I presented my work on looking at how actually dogs with flatter faces and without tails struggle to communicate, and the level of anxiety that can create in the human caregiver and obviously also in the dog. And the more that I think about it, and the more it's a PhD. Somebody needs to go and do it. I don't mind if it isn't me, but somebody needs to study this really well. There's been a little bit of research over in Australia, but not enough. And the more that I think about it, even dogs who have to pant, in order to sniff and take in all the information you need socially, you need to have your mouth closed. So if you're having to fight between breathing and reading the environment with your nose, like that again is a huge welfare issue. They're not participating in the conversation because they're having to focus on breathing rather than closing their mouth and sniffing.
But it must be like, for a dog looking at a flat face, talking to Voldemort.
Yeah, it is. They can't move their face. And you're like,
yeah.
What is wrong with you? Why are you
always
instantly
angry eyes?
Yeah, it's true. It's so true. And we need to sort this out. It's not their fault that they were born in those bodies.
But it goes on even further, because we see a lot of these breeds, and the compensatory bracing patterns that they use to compensate from these conditions. For instance, their necks tend to be terribly, terribly loaded because of their back end problems. And they're very compressed anyway. And their neck, and they get this dry nose, which in my experience and from all the dogs that I've treated, I have seen hundreds of dogs with dry noses that have become wet after we've treated them, because it's actually, for me, connected to a neck problem, a tight neck, tension through the neck.
Wow.
Very specific part, but these dogs are now accepted to have dry noses. Very, like you were saying, Hannah, but also from subluxating patella, which of course is a very common condition with these breeds. That creates such compensatory issues.
That for the layperson, Julia, is a knee issue, right?
Sorry,
okay.
Yeah. So I was on one then, wasn't I?
It's good.
Go.
It's good.
Carrying
Pull
on.
a string.
Yeah, do it.
Turn the light off. And of course, we're now learning much more about these myofascial connections, which I talk about a lot, these functional lines that actually connect muscles to create movement. And when they are dysfunctional, it's not just the movement that becomes dysfunctional, it affects the whole body. And one of the main postural muscles, it's in the human, and it has been looked at in the canine too, goes straight through all the viscera and affects the autonomic system. So these dogs also could have anxiety from their muscular issues on top of everything else.
Gosh.
But by that time, you've got it so layered. Where do you start?
But you do see, I'm not picking on the French bit because you will see it in a lot of other breeds in the vet practice, but a lot of that specific breed do come in with difficulty handling, anxiety, have to stay outside, have to be kept in the car. There's a number of breeds that are like it, but you can imagine being bloody angry.
Yeah.
You know, I've got a bit of a bad back at the moment, and I'm just a bit snappy.
Yeah. Bit prickly.
Snappier.
Yeah.
Snappier.
Thank you. Yeah.
Here we go again. Number 2 for you, Julia.
Number 2
would you like to say?
What? Let's
number
go
3. We're in
to
number
the
3.
environment.
Oh,
3.
Yeah.
Let's go to the environment.
Okay.
The dog's environment. I think that's huge. And we know it's huge because, and it goes back to what we were talking about a little while ago. It's almost like pick your battles. And that's very much how we view it. There are so many things and there is a capacity that a guardian can take on. So generally, if we're going to suggest changes, we start with the environment. And then we can work down to other things. But the environment is huge.
So what kinds of things? What would be your areas?
Flooring to start with.
Yeah, flooring's huge, isn't it?
I mean, it's something that we've been talking about for years, and it's lovely. And thank you, Hannah, for really taking that on and bringing that out, because we've been talking about it. We've been shouting like this, slippery floors, but you've just gone slippery floors.
Yeah,
and it's great that people are now beginning to realize that how impactful it is. And it really makes a huge difference. We can tell the difference in a dog's physicality between slippery floors and non-slippery floors, but also from having a treatment and then having rugs put down, non-slip rugs. We can tell the repair the change, the progress in that dog's whole interoception and physicality. It just changes.
I've seen dogs do the floor is lava. Definitely, like in houses that I've been in that have been like, I'll walk on the carpet and then I'll walk around the bit that has no carpet to the other bit of runner, and they're playing the floor is lava, and I'm like, can you see how your dog is navigating the environment and they're avoiding the slippery floor? Yeah, it doesn't like the slippery floor. I'm like, no. So what are we going to do about that? And we just go, oh, he's just like that. We just don't kind of pick up on that little behaviour cue and go, I could improve my dog's life by putting some carpeting down.
Unfortunately, dogs are their own worst enemy because they're just amazing beasts that get on with it.
They just get on with it. Yeah. If they've got
if only they did. Oh, actually, no. Many of them don't get on with it, but then we see them as problem dogs. The fact that they're going, no, not coping, and we're like, oh, well, you're a problem dog. But they are incredible animals because they kind of mold into our lives so much, don't they?
Exactly.
That's true.
Yeah, so I would definitely say environment, but other things too. The floors are the big one, but repetitive strain on any level is going to be a problem. And of course, then if you've got the unstable or the instability with the body too, they're not as resilient to be able to take up the leaping up and down of sofas, beds and things like that. But number one are the floors, without doubt.
So I feel like what I need to do is drop my dog into this situation, because I am your classic nightmare case, I think, for both of you. And I'm dropping him in because I want everyone in the world to know that it is very normal for us to get ourselves into these stupid situations. So I have a chocolate cocker spaniel. He is 8 years old and he has arthritis. At 8 years old, he is a baby, really. He's not. He's getting on a bit, but he's got mild arthritis and, slightly dodgy hips, okay? So a little bit of hip dysplasia there, and he's got arthritis. And I have I'm a dog trainer, so I've done lots with him. He's a spaniel. He loves a ball. And I loved for a long time a ball wanger. That's what I call it, because you welly wang. People don't like that word, but I think it's completely appropriate. Wang the ball with a ball wanger. Some people say ball thrower, whatever you like. And I did, a lot of ball throwing. And I know that is like one of the big no-nos in the world of improving your dog's everything. And I can guarantee that I've broken my dog. If I look back, what I now know compared to what I didn't know when he was younger, I took him to skate parks and I'd have him running up and down the skate ramps and like slippering down these, concrete edges. And I was like, he's having a great time. He's getting proprioception, he's strengthening his muscle groups. I have no idea because I don't know enough about posture and anatomy really and all of that conformational stuff. I don't think enough people do. So I know that I've broken my dog. But what is the alternatives? Because we're going to need to throw a ball for a dog. Like I don't feel like she's saying, I feel like the world is going to keep...
Whoa, stop. Okay. I'm going to have to rant about this ball concept.
Come on.
Now, I do this quite a lot in consults, and you can see my nurses just go, oh, don't let her do this. If you were to go to a really beautiful art gallery, amazing oil paintings, beautiful 15th century, 16th century, 17th century, there's man with dogs, yeah? Do you see balls? No, you don't. It's a very new thing. It's a very, very probably 19th, 20th century thing, probably 20th century when you think about it. This ball thing is something that is trending in this century. You don't see them historically. And they're bones, dogs and bones, kids' books and stuff. It's all kind of like social constructs. Dogs don't need balls.
But they become addicted to them, which is a huge problem.
Same as Pringles, very addictive.
Very
I don't need
Pringles.
them.
I think I have to hold the corner for the trainers in the world who are like, this is a high level reinforcer. There's literally nothing in the world that my dog loves other than me more than.
But there are other ways you can do it. There are other ways you can do it.
To get that breed driver out and also I think you've got to like bear in mind that it's addictive for the human. Like we love to see the joy that is exhibited in our dogs, and the only time that they really get to do that full run is when you've lobbed a ball to the other side of the park. So my argument is not that I'm not gonna. I want to hear you out. I want to create space to have the conversation.
I like the debate.
Yeah, but it's got to be something that is practically applicable, because if we say to people we just stop throwing the ball, they're going to be like, exactly. How do I what would I put in that place there? But before we get into that, tell me why throwing the ball for the dog is, from your perspective, both of you, so bad. Like, what does that do to the dog? Why is it like Top of the Pops needs to be slain from your perspective?
Have you ever looked at your dog at the point of catching the ball and twisting in slow motion? You have?
I haven't. No. I mean, I think I've got photos of him catching like a frisbee. And
look at it in slow motion and look at the contortions of the body. Now, it's all about the repetitiveness. It's not about the one-off. It's not about the two-off. It's about the repetitiveness. And one of the most damaging movements a dog can do is that transverse movement where they twist, where their front end goes one way and their back end goes the other. And it's the first movement, the first plane of movement they lose. And that's the most damaging one. And once they have overdone that corkscrew type movement enough times, the body starts to lock down because it becomes dangerously unstable. And then you get the dog that walks on stiff legs, but will still run for the ball, but that rotational spin has just become too much for the body. The body shouldn't rotate that much at that speed with that impact.
And actually,
I'm going to grab it and talk socially.
Go on.
I see lots of caregivers that would never listen to a podcast about dogs. They love their dog. but that's it. And so the daily exercise requirement fits around their life. And isn't it easy to just pop to the park down the road and lob the ball a few times and then pop back home? That's their life. That's they've got big work requirements, they've got family, they've got all these responsibilities, and it's become normalized to just do that. That's good enough exercise. That's not socially fulfilling. That's not psychologically fulfilling. And I think the fact that we've normalized it, and do you know what? I saw bloody ball chuckers in a petrol station the other day. You know, when you see those stupid adverts, $4.99, get a pen torch. I was like, you have got to be having a laugh. Ball chuckers in a petrol station. And to add to that, have you seen the little pink ones? Short and pink. They look like ice cream scoops, and they're for puppies.
Oh.
So if you pop into Pets at Home, I give you full permission to wipe the shelf. Just lose it. Grab it in the air. Throw it in the air. Throw it around. Cause a stir. Because that is insane, isn't it?
This is the same way I feel about extendable leads, by the way. This level of vehemence. I have this level of vehemence for extendable leads. So I feel you.
And we just need to kind of like really try and talk about it. As Julia says, you know, the occasion, or if they're warmed up, or if they're conditioned for it, or if it's part of their training. So we talked about it a few years ago, and I got horrendous hate mail. And then I found that there was the anti ball throwing groups popping up on Facebook. There's a really big difference to somebody that's using it as part of a training plan, somebody that's using it as part of agility, as a reward afterwards, or whatever it might be, and somebody that actually understands the power, but also, you know, the chaos. A bit like Lord of the Rings, the ring, the power, but also the damage that can be done. When you've got people like that, that's absolutely fine.
Yeah.
But that's not the people that when they go and pick up their puppy, they pop down to Pets at Home, they stay in that sodding aisle where everything's pink and blue, and they think it's normal to pick the bed, pick the harness, pick the extendable lead, pick the little ice cream scoop ball chucker. No. It's not normal. And I'm going to grab the microphone and run away with it. So my friend told me this story, and she is got an MSc in behaviour, and I haven't seen the paper, so I will have to chase her up and find out. But she was describing about a study where they took some dogs and they put them in a room, and it was a perspex partition to see through, and there was holes cut in it, and they put bowls the other side full of food, so they could come into this room and they could go put their head through the hole, get to the food. Brilliant. Did it multiple times, so that was routine. The food was always available behind this perspex. Then they put them in the room and they'd filled the holes, so they could see the food but they couldn't get to it. And the postures, the facial expressions, the behaviour patterns were very similar to what we see when we're getting this obsessive, he's so happy. He's so happy about, you know, what we're doing. He loves it. And I was like, well, the dogs that are looking at the food and they can't get it, that's not happiness, that's frustration, isn't it? So are we getting confused between what our dogs are asking of us? And should we actually go back a step and be teaching people about what really is contentment and happiness in a dog? Sorry, right.
Really good. No, it's really good. It's so good. It's important. And actually,
the thing is,
yeah, go on.
I've seen, well, as you quite rightly said, I've treated thousands of dogs, and always in the history we ask about, you know, activities and things, and every dog that has a ball throwing, there is always something that you can relate to that on the body, because we can feel the body. We can tell you almost what activity. Our hands are so sensitive. We can tell what they have. So we can tell that they have been ball throwing, or ball throwing's been in their life, even if it was historic. But going back to your question, what could you do instead? And that's a really good question, because that's something we always have to, if you say, no, you can't, you've got to say, but why don't you try this?
Yeah.
So hide the ball. Once a dog has learnt that ball, it's very difficult. But there is something in dogs that do love that ball.
Yeah.
So hide it. So make it into more of a scenting game that is much lower impact. It's not that high impact repetitive game. And it also becomes a much more fulfilling game. It becomes much more brain work rather than just pure hormonal physicality. So that's what I would suggest.
It's also, I'm just going to go back to what Hannah was saying, because I'm just playing with it in my head. Because you talked about it, there's nothing greater than seeing them go full pelt. And I totally get where you're from, because I broke Holly. I played loads of chase games and, retrieve games, and wasn't aware of the surfaces and what I was requesting of her all the time, or allowing her to do. And there is something weird about us wanting to see things looking like they're having the best time of their life by sheer physical prowess. The race horses, the full-fledged greyhounds, the agility dogs flying around. Why do we want to see that? I know that sounds daft, because that kind of full pelt in the dog's repertoire of behaviours would be for a reason.
Yeah.
It would be a survival thing, or, survival, be it you are the prey or you are the predator. But why do we want to witness it? We've got to be more accountable for our own pleasures, haven't we? As much as we're accountable for the fact that they live in our world. And they also appear to have to entertain us.
Yeah, that's one way of looking at it, I suppose. I mean, I think for in the most innocent, in the most human, like pro-human approach, like if I give humans the benefit of the doubt, I think for most of my clients, I see them going, I want to see my dog, breathing heavily. I want to see them doing cardio, because I know how important that is for my lifestyle, and I don't get enough cardio, and so it's important my dog, should be puffed out. That's some of my clients, like that's me doing a good job as a dog owner, is to get my dog tired, or that, I want to see my dog build muscle groups. There's lots that have, bull breed dogs that might do lots of jumpy, tuggy games because they really want to, build those muscle groups. And sometimes that can push into absolute vanity, but sometimes I really do think they are intending the best for their dog. They're like, I want my dog to be physically healthy. And how do I get my dog to that level of like physical health? Because I'm the only person who gives them access to the environment. They can't chase cats. They can't, kill rats. If you're a Jack Russell, they can't chase after, foxes or whatever. If you're a beagle, you just can't do that anymore. So we need to find alternative ways to kind of satiate that breed driver, that predatory urge. And I think that is more of it. I think more so than the human just really wants to see their dog happy. That's what most of the people that I interview, they're like, I just want my dog to be happy. And if the greatest minds in the world got together and went, actually, this is what your dog would look like happy, and we were able to give them a better alternative. As Julia said, I love scent work. I love it. When I'm doing proper gun dog work with my dog and I'm setting him up to do gun dog work, he's in a sit state and I lob the toy and I wait and then I send him, and then he's not running at this. He just still run after the ball, but he's not going to, it's already hit the floor. So he's not going to jump up and grab it. Number one. He's also, by the point that he gets the ball, he's had to use his nose because it's been lost in some grass. So that's really satisfying for him. And what I've got into the habit of doing now is I put him in flat dog. If I'm just in a field and there's no way that I can throw it without him seeing it, I ask him to lie on his side and wait, which we've built as a game. And then I throw the toy and I wait, and then he has to get up and go and look for it, which again, I could teach him to do more slowly because there's probably neck jarring that could happen there, but it stops him going, hell for leather after the ball. So it just helps him to do sniff work instead of chase. So I've adapted it because I know that I'm doing something that isn't as great for his body as it could be, but I know that his brain is like, and equally as a behaviorist, I see this little addictive creature who's just like, I want dopamine. I want it. I want dopamine is so good. I want it more, please. And after about 5 repetitions, I go, that's brilliant. Give me the ball and now go do some sniffing. And I have to actually tell him to re-engage, just like you might have to do with a child and a screen. You're like, okay, now take the tablet away from the child because they cannot not look at it, and we need to be able to create these boundaries for our dogs so that they're not constantly obsessing about things that just give them dopamine, and missing out on social activity and opportunities to sniff and explore the world and do things that might push them out of their comfort zone a little bit more than just holding a ball.
But I think it's, you said, somebody said to me once, and very facetiously, and I love it, and I do use it every now and then in clinic. You really enjoy spending time with your dog, don't you? Why do you keep sending them over there then? With the ball wanger. Why do you always send them so far away from spending time with you?
Yeah, wow.
And you can see them just go, she's crazy. She's stepping over the line. But you do kind of sit there and go, actually, it's worth mulling that one over, I definitely don't have it right, but I enjoy going on adventures with my dog. They have lots of free rein. I'm very lucky. I live in places where they can be off lead a lot, and we go on adventures, and there's a lot of them finding and exploring the environment. But I want them with me. I don't want them freaking far away.
Yeah.
I do lots of clove and gun oil scent work with my Labrador, and that I love that on so many different levels, because it's good for her. And this is what definitely seems to work. If something is good psychologically, it's good physically. And the type of scent work she does, which is obviously finding minutiae particles of scent in outside areas or inside, really difficult, high, low, all over the place. It's so good for her because she's moving relatively slowly, but also her body is naturally moving in her own direction, finding these scents. So she is using proper functional correct anatomical movement off lead, herself, and problem solving. And watching her develop has been amazing to watch how now she works things out, how she's going to cover an area. But also she's really quite noise, or pretty much phobic. We're on that scale. And because of doing this, and I know there's a real correlation here and something that's going on, which is really important, but she can continue to enjoy her scenting even when there's a background noise that I know that she would normally respond and really hate.
Amazing.
And it's giving her better coping skills to be able to manage that herself. And that is another layer of how this is so incredible. And we also do a bit of man trailing, which is amazing too, and blows my mind. But the scent ops type thing is just...
It's so good for them, isn't it?
It's so good, but I love it because she's in charge.
Yeah.
I'm watching her. I have to help her. If there's a place that perhaps she's missed. I have to be aware of that. And that sort of dynamic is just incredible. I love that.
It's really good teamwork, isn't it?
It the best. And I think if we could do more and more scent work, even if scent work was part of the conditioning towards going on and doing different types of more physical activity, it really is inviting the dog to move naturally, but slowly, which actually does build their muscles better. Fast work doesn't. Slow work does, because it builds them from the inside out. And then the fast muscles develop easily. It's those slow ones, those deep ones that we really need to be focusing on, which needs multi-directional slow movement. So those sort of things that she, at the end of a scenting session or competition even, she's just, you can see her almost reliving it, but in a really nice way, in a very relaxed way.
It's exhausting for them.
That is so cool. I'm just so pleased I've discovered that.
If your dog is lying down, they breathe at 15 reps per minute. If they're walking, it's 30. If they're running, it's 60. If they're sniffing, it's up to 300, 200, 300 reps per minute.
Wow.
It's like a totally different. And it's in and out. And each breath is getting sniffed by each nostril and then processed by the brain. So like it really is the most exhausting thing that you can get your dog to do is scent work, 100%. And people don't see that. So, and I let's get into prevention a bit more, if that's all right, ladies. I'd love to talk a little bit more about prevention, and I do just want to give your book a shout out, Julia. I'm flicking through it right now, and like, you know, we don't get taught this as trainers. We don't get taught nearly enough anatomy, and there are some really cool pictures all the way through, like some really helpful breakdowns of, you know, how your dog's body is experiencing each of these situations and like how it can go horribly wrong as well. So if you're just listening to this on a podcast, you can check it out on YouTube too, and look at the pictures that I'm showing. You can just get some ASMR of me holding a book. That's nice too, isn't it, for those that like a book? But it's fascinating and stuff that I wish that I'd really known way before. But what do we need to know about prevention, guys? Like, what are your top tips for us preventing pain and injury in dogs right from day dot?
Think about what breed you're getting.
Mm-hmm.
That we've already covered that, but do look into what breed predispositions that breed that you're really interested in, and then obviously find a suitable breeder that's potentially using some of the health schemes to try and reduce the prevalence. That would be really important for me.
And I guess look at the parents too, because you'd be amazed how many people buy dogs from parents whose like feet are pointed out in the wrong direction. You're like, that's actually not normal, guys. Look at the leg. Like the leg needs to be straight, doesn't it? Pretty much, and the feet need to be pointed forwards. Am I right? That's
most breeds.
It depends. If you've got your chondrodystrophic type daxies and stuff, that just doesn't happen.
What's that then? Is that normal?
Oh, so that's there's a cartilage anomaly, and that's why they have like intervertebral disc disease, because the intervertebral discs start calcifying at a very, very young age. So it's like a cartilage anomaly. So they have the Queen Anne legs, the very shortened legs.
Mm-hmm. And bowed, or is that we don't want them bowed? Yeah, but that's a disease, right? That's a problem. Yeah. From day dot, we've bred them with the wrong shaped legs. When
you look at breeds historically, we've kind of warped them, haven't we? So when you look at things like, for example, the Shar-Pei, look at the Shar-Peis of the early like 1900s. They don't look anything like what we have now. It's insane. So, but yeah, just being really conscious. I know that I love border collies. Luna is the apprentice of Holly, and I have a sheer weakness for how amazingly emotionally connected they are. But they come with breed predispositions, and you have to be really conscious of that. I know certain colleagues would say to me, if you really believe what you're saying, then you shouldn't really be continuing to support any breed. We should be trying to step away from that social structure of having to have a breed of the way it looks. But I do think that that's never going to happen. I think breeds are here to stay. So the best that we can do is actually say, be conscious of what breed you like and you're drawn to, and do your damnedest to learn about its predispositions, and then do your damnedest to find breeders that take responsibility of breeding really, really healthy examples.
Really good. Really good. Okay, so find and breed good dogs. Yeah.
I would then go to the other, not the other side at all, because obviously I completely agree with what Hannah's saying. But then again, we are working with and managing dogs that people may rescue, or people. I know so many people that I'm going for a puppy. I'm not going to rescue another dog. I'm going to have a puppy. And this poor puppy, these puppies seem to find them, and they tend to be the ones that need the most help and everything. So for me, physically, to develop a dog physically, it's about understanding how that dog needs to develop. And it's not anything clever. It's actually just looking back at how they would do that in their own environment. So for a start, as I said, the flooring, but being able to get traction is vital. But for a puppy, to build a puppy from the inside out, or if you're rehoming, just treat them like a puppy. Start from the beginning and treat and build them from the inside out, and do slow, multi-directional work, exercise, limited, not too much. Allow them to take on that functional movement of moving in different directions, not just in a straight line. Mm-hmm. That is one of the worst things we can do, is just walking them in one plane of movement. They've got three main ones, and they need to be using all of them. And so puppies need to develop all those planes of movement early on. And I reckon we've got about between 6 and 8 months, a bit like that socialization window, to really get that pattern in place. Mm-hmm. So it's in place. It needs to be reinforced. But of course,
what would that look like, Julia? If you could like describe an environment that we could set up, or even just an exercise that would create those different types of movement, what would that be like?
If you're inside, you can do something like an enriched environment, so boxes and things for puppies to investigate. So basically, they're putting their head round and about and going under things, around things, moving on different surfaces too, but always allow them access on and off. So you don't put them on something, you invite them to. So that you may put a treat on there, but so they've got easy access. So if they're not comfortable, they don't need to do it. Really but good. Then they'll get more confident, because it's all about movement confidence too, is they build their own confidence without being forced to try that activity. And so it may not look much to you. Well, why can't they walk over that cushion? Well, actually, that feels really unstable. So it's allowing that natural being sort of curious and that experimental sort of physicality. So you can do it inside. So you can do it inside with enriched environment using different bits of material, but also that helps them. Things like the vacuum cleaner, they can meet that in a different environment rather than just a noisy one. But outside too, exactly the same. Allow them to explore. And the best thing is if you're in a wooded area and there are lots of twigs everywhere, just allow them, don't pull them through, don't invite them, don't sort of take them on the lead, just allow them to move in amongst these sort of twigs. So they have to move all their 4 legs separately. So they've got to join themselves up. And if it's on a slightly different angle, even better. But again, allow them that escape. So that's sort of what it looks like in a small nutshell.
Really helpful. Thank you. So lots of different multi-layered environments.
Exactly.
Letting your dog have a go, letting them escape, not sort of guiding them through necessarily, but, you know, giving them an opportunity to explore at their own pace without pressure. Really cool. And don't put them on stuff, because then it's like chickens, isn't it? If you want to collect chickens, you stick them on a fence, because they don't jump down if they didn't jump up. They're just like, I'm not getting off it. I don't even know how high up I am. I have no idea. It's true. That's how you collect chickens.
Like chickens.
Just like chickens.
Like chickens on a fence. I'm going to quote you on that.
Yeah. I've never heard that one, but I like it.
It's true. It's just, that's how you collect chickens. It's a different life. Okay, cool. Good. So multi-layered, lots of environments. Get a good dog. Give it good opportunities to grow and develop well. What else? What else is going to really help us with prevention?
Wait. We've got such a problem with people not understanding what...
W-E-I.
Oh, I'm not being rude to you, Julia. I would let you know.
Everybody stop. W-E-I-G-H-T, she's saying.
Wait, Julia. It's my turn. No, body weight.
Yeah.
Body weight. Yeah. We really... It's
a silver bullet, that one, isn't it?
Oh, God. So the figures now are around about 60% of dogs are overweight. 37% of juveniles are overweight.
Wow.
If they carry weight as a puppy, they're more likely to carry weight as an adult. Huge health consequences of excess weight carriage, psychologically and physiologically and physically. And the Andrix puppy never did us any favours. He was fat.
Big, fat, chunky puppy. Yeah, tricky.
That's the thing, is a lot of people I was told by my mum, oh, you're going to grow out, and then you grow up. You grow out and you grow up. And they now know that that's not the thing. We shouldn't be falling into that trap. Should be using the puppy growth charts that you can actually look at what size you suspect that your dog will grow into, and you can follow a healthy trajectory of growth over a time frame. But I do worry at the amount of people that just brush it off. Garfield, he was another problem, wasn't he?
Yeah.
Let's blame Garfield
Big
as well.
fat cat. Mm-hmm.
Big fat cat.
Mm-hmm.
But yeah, we don't take it seriously enough, and it's a massive contributor to many, many health concerns.
Okay.
Yeah.
All right. Good. Really helpful. Okay, so we have got a good dog breed. We have, to the best part, managed our environment. We've got good flooring. We've got carpets. We've let them do some, decent like building of their internals by working in lateral movement and clambering over things as puppies. We've been a bit of an idiot, and we've done a lot of ball wanging as a teenage dog because it felt good for everybody at the time. And now we have a problem.
Can I just stop you there?
Yeah,
Can we go back one little step?
Yeah.
Free movement is so important. And also for a puppy dog to be able to run unlured, unchased, just have that opportunity to be able to run free. That is so important, because it's not, slow movement is incredibly important. And walking with your dog, this is so important. When people walk on a lead with their dog, all dogs are smaller than them. Every dog you walk will have legs that are shorter than yours. So why are you walking at your pace? You should be walking at the dog's pace. So we're just teaching them to trot.
Wow.
We're not teaching them to walk. And walk is the most important gait of all for building and for rehab and for everything, because it's a 4-time gait. So we have to walk at the dog's pace. And that's why it's nice to let them sniff, because we don't need to walk with little tiny steps. We can just let them sniff. But they need that free run as well. Unlured, unchased, no treats, just that free run. And for puppies, not to be wrapped in cotton wool.
Well, that's what I was going to say. I think behaviourally, psychologically, emotionally, isn't it one of the leading causes of elective euthanasia of dogs under the age of 1 or something like that? Or it's of juveniles, isn't it?
Yeah.
Is behavioural problems. And giving them the ability to grow into the environment in which we're asking them to live, I think is so, so important.
It is. I mean, I would say we
shouldn't be in prison.
We need to have a serious conversation about this vaccination window. I think that's going to make a huge difference. As I've always said to, I've taken my puppies out earlier than, a vet would say that is a good idea. But I'm like, but more dogs die of lack of socialization than die of lepto and parvo. And maybe there's an argument that that's because they're being kept in for that window, and that's fine. But actually, it's behavioural issues and a lack of access to the environment that
I think you can do a
is
risk
killing
analysis on that, can't you?
it's a
Really,
good
and I
shout.
think it's the same as anything with humans, like the 5 fruit and veg a day. Where did that come from?
I know, it was just a generic like slap it in.
Yeah, because we need to have this kind of black and white advice, don't we? And when you actually go, right, let's do a risk con analysis on this, and let's make the right decision for that animal at that time. But I think a lot of us are underconfident about thinking. We're quite keen to be led and told what to do. But
I think we're also not taught just to observe. Just observe, just watch. I mean, everything, well, most things I would say that I have sort of discovered, if you like, and brought forward have just been from observations. So it's all dog taught and then supported by either the anatomical science or now some of the other sciences coming through supporting. So it really is observational. And I think looking after any animals, having any animals in your life, just watch them.
I agree massively. Big fan of dog watching. That's my heart. That's all I spend time doing. But I think we do have to just recognise here, ladies, that there is a small affordability issue. I think like we are very fortunate that we've had capacity, space, time jobs that have allowed us to give dogs space to be dogs. And actually, there are lots of people out there. Most dog owners, I would say, don't have the luxury of time, space, confidence, capacity to spend time watching dogs. And I do think we put like a huge pressure on dog owners to control their dogs from day one. Like that is, it comes from government, it comes from training, it comes from telly, it comes from social media. And it's like, you need to have your dog on lock, like from day one, you know, or at least by the time they're 6 months old, like control is key. So that's really hard. You know, how we want to be able to invite people to have, space to let their dogs, you know, I would love to take a puppy to most woods and I know the right age where I can let them off lead and be like, just follow me, you'll be all right. But most people, I'm like, no, honestly, just let them off. And they're like, no, it's a brand new puppy. I'm like, trust me, he's going nowhere, he's following you and that's it. But it takes education and time and resource really to get to that point where you're confident.
But there has definitely been a change. Like when I went off to Morocco for a year, I can remember my mum saying, you're going to see a real difference when you come back. People are very different with dogs now. And I was like, I've only been away a year. What can change in a year? And I came back and I was like, good God, it does feel different. There was, I'm very lucky wherever I am living, being a bit of a nomad, I tend to be in areas where the dogs can be free for probably 98% of the time. But when I am in environments where there is the potential to be free, but not so free now because everybody's on a lead now, there is a change afoot, isn't there? Whether it's because the canine population's increased dramatically because social media really, really advertises all of these dog-on-dog conflicts, and people have changed their kind of social responsibility to dog ownership. They're in fear. I don't know, but have you noticed it as well?
I think it depends. I mean, I've moved from Birmingham into, Kent. So very different. Like I've moved from the central centre, very different, like an entirely. And to be honest with you, a little bit of that was because I couldn't go. I trained 10,000 dogs in 10 years. So everybody's dog knew me in lots of the places that I would go. Me and my dog, who's not a massive fan of other dogs, if I'm honest, couldn't get away from my clients' dogs. I was like, I need to go to a park where nobody knows who I am and nobody knows my dog. And now, the numbers of dogs that we would see on a walk are maybe 3 in a beautiful piece of, a reserve. So there's a lot of space, there's a lot of freedom. And most people, when I walk towards them, if their dog is on a lead, I put my dog on a lead. If my dog is on a lead for whatever reason, they put their dog on a lead. And I love it because there is that mutual respect and conversation that's happening there. But in the city, inner city dogs, not a lot of space. I used to label all the parks in Birmingham based on like stink rating. I'm like, this is a particularly stinky park. Like the number of houses around this park that this park has to like exercise, the amount of dogs that this park exercises is high. So I call it a stinky park. And then others would be, have little difficult bottleneck places that people could go. And so, there was a lot more dog conflict because just of the volume of people using a smaller space. And that's harder. It just is for people to give their dogs the exercise, give them the freedom, and again, avoid using, balls, chuckers and stuff like that to just get their dog some form of exercise that for them feels like that's enough,
And this is why enriched environment, you can do it. I've worked a lot with people in Taipei who basically live in an apartment and the greenery is very limited. And they really work hard to try and create a fulfilled life for their dogs. And I really admire them for their imagination. But actually enriched environments, they sound a little bit but actually it doesn't take much to make a really fun, fulfilling one for a dog. And that really does help them mentally and physically. And then they've got that fulfillment, and perhaps they haven't got that frustration so much from living in a limited space. But every time they do it, it's different. So it just takes a little bit of imagination. And I quite agree. Not everyone has space, not everyone has the money to invest, but it can be done using just a little bit more imagination, but also just knowing about these things. It doesn't take imagination. You need someone to go, how about this? Try this. You go, wow, is that really as good and as easy as it looks? Yes, it really is.
Yeah.
Just put a lot of, you may have your delivery boxes. Just use those.
Love a box.
And if the dog
just
decides
rip up a box.
Rip up the box.
Yeah. Brilliant.
Who cares? Brilliant. Pre-recycling.
Yeah.
And it's those really simple things that people, I think people with dogs would love to know. We all like inspiration of how we can give our animals more fulfillment. I mean, I've just recently, I keep horses, I've put apples on a string. And of course, they're trying to catch it. And to watch them do that was really fun, and they enjoyed it. And it didn't get to that level of being frustrating because they got their reward. But in the meantime, they were moving around and trying to work out how to get them. And it's just the same as you can do in any room of your house or anywhere. So I'm a big enrichment fan, and you can create those movements inside.
I love it. Okay, so we've done some great prevention here. And I feel like we've got a really good list of things that we can be thinking about when it comes to preventing pain in dogs. But let's talk about management, if we would now. And I did say at the beginning we would talk about curing pain. And I know that that's a difficult subject, isn't it? Because it's not as simple as that. And Hannah, you have done some exceptional work in promoting the cause of canine arthritis management. Could you just tell us a little bit about how that started and where it's at right now, and what you've experienced when it comes to managing and working with dogs who are in chronic pain?
So it started from when I was in my dark period. Julia's fault.
In the dark period.
Julia's fault.
Not funny, but it's a bit funny.
It is. But so I'd started a mobile service. So during the evenings and at the weekends, I'd go to people's houses and I'd offer myself as a vet, offer Garland myotherapy, offer nutrition advice, exercise advice, weight control, blah, blah, blah. And I was finding myself spending an hour and a half, 2 hours with people. And I was thinking, this is not effective. A lot of what I'm saying could be applied to other people if they're willing to listen. I don't need to be in their homes. So I set up a Facebook page and just wanted to share what I was finding in people's homes, common mistakes. And it just went crazy, way beyond what I thought. And, within a few weeks, there's 500 people and there's 1,000. And then suddenly we're at 20,000 and 30,000. I was like, okay, so the vet belief that owners of arthritic dogs, the caregivers, are not interested in knowing more is flawed.
Yeah.
This is evident that it could be the vets that are the bottleneck to change. So from there, I ended up writing a website. I was very studious. I would get up about 3:00 in the morning before work, try and get a few hours in, and then go to work. And it cost me £2,500 of my own money. I got a 17-year-old computer geek to do it for me.
Well done.
And like months and months of work went
They're not
into
cheap,
it.
are they, websites,
No.
actually? They really aren't. Like,
No.
I've spent too much money on websites.
Yeah, so I ended up launching it, and I can remember I was away for the weekend and I started emailing all of these vets, colleagues that I knew, and I really expected everybody to go, amazing work, Hannah. None.
Oh, hun.
And I was like, oh, right. What now? Right, I'm going to get really angry about it. I'm going to shout louder, because you could become quite despondent and go, okay, well, it's not worth it. But then that just, that's kind of just fueled me for some weird reason. It's obviously my passion. It's my reason to be on the earth. That isn't going to be a reason to stop. That's a reason to keep going and try harder and try different techniques. And where we're at now, proud to say it's not just me anymore.
Yes, Hannah. Also,
nice.
Can we just say you're shouting about dogs who can't shout? Like that is, I think I spoke to it was a physiotherapist once that said to me, Hannah, if your dog is demonstrating that they have pain, they're on a 5 out of 10. If you can tell even vaguely, then that's 5 out of 10. Like, that's horrendous.
Yeah.
Like a mild limp, the dog is already 5 out of 10. So you should shout loud about that. And I'm so proud of you for doing that, because so many dogs have had voices because of the work that you've done. So, yeah.
Well, thank you. Yeah, I've tried lots of different techniques. Julia will know, because I've come and cried on her shoulder quite a lot over the years. And I do strange things, like I'd be offering lunch and learns, and, I haven't got a certification or, further ed to go into a practice and go, listen to me. But I did. And I'd be driving all around the country going, I'm going to come and do a lunch and learn. And I started doing owner kind of like evenings where people could come and listen. I took any opportunity to talk at events. Whatever was thrown at me, I said, yes, I'll do it. And where we're at now is we're holding like the Chronic Pain Symposium. We've done that 2 years in a row. Last year we had 8,000 attendees, so, which is pretty amazing.
That's amazing.
We're currently in the process of reformatting everything, but we try and reach out to professionals with professional education. So that's vets, vet nurses, physiotherapists, behaviourists, dog groomers, dog walkers, anybody that's got a stake in the canine kind of industry. We do practice trainings where we go into vet practices and we train the whole team, which I find really important, because I can remember what it was like when I was on my learning journey, and I'd go to work and I'd be full of all this new knowledge and these new concepts and things that I feel really needed to be implemented in practice, but I hit obstacles of other people's, well, this is the way we've always done it, Hannah. No, but this way works, Hannah. They're only here for a short period of time. It really doesn't matter about the flaws or the handling. They're just in and out. It's fine, Hannah. So I know what it's like if we were to train an individual and they go back and they have the same kind of obstacles. So we're really keen to get into practices and train the whole team, from receptionists, vets, vet nurses, you name it. What else do we do? We do quite a lot of stuff. And it's not just me now, which is amazing.
Yeah.
So I've got an awesome project manager called Harry. I've got my web designer and beautiful soul Blanca. I've got my marketing lady Jo. We've got Nikki, who's doing social media. I've got Evie that does endorsements, outreach, advisors. I've got Laura that does the professional newsletter. I've got Rebecca that
Come on.
But the team's grown
Hannah.
significant. Harmony that does education. Her mum is involved as well. We're a proper little unit. So it's quite a big team. And it is very expensive to run now. So people, if you do use the resources, please try and give back, even if that's to encourage your caregivers to join the member zone. It's only £35 a year, but the business strategy, we just thought that people would use these services. Say you, Hannah, were working with a dog that you suspected had arthritis, and you could say to your caregiver, do you know what? We are sending you to the vet to go and get this checked out, but I really strongly encourage you to join this. It's less than a consultation. You've got membership for a whole year. In there is everything you need to know. Because if we had more people doing that, then I wouldn't cry about money every month.
Oh, honey.
Trying to pay people's wages.
Yeah.
But I think we've definitely grown. And hopefully with this new award, we'll get more airspace.
Yeah.
That's what I'm hoping.
It's important. It's really important. And yeah, it's made such a huge difference already in people. First of all, awareness, isn't it? I think that's the first thing. The first stage is realising that you have a problem, isn't it?
No, no.
That's the first stage one. So I know that I have a problem. My dog has arthritis. I don't know how to deal with that. And I want to improve it, and it is a journey that we're all going on, isn't it? Many of us, sadly, even with 8-year-old cocker spaniels, that by people who should know better.
Well, let's do facts and figures. So there's a study out in 2023. Dogs between 8 months and 4 years old, 40% had arthritis.
Oh my goodness, terrifying.
Oh yeah. So 16% had moderate pain associated with radiographic signs of OA. 24% had mild to moderate pain.
OA is osteoarthritis.
Osteoarthritis. So there was 123 dogs in the study. They were just from people in and around a university, first opinion practice. And it was a massive study because all of those 123 dogs were invited to participate. It was all free of charge for the caregivers that joined in. And they had a veterinary professional, so a specialist, clinically examine every joint, range of motion, crepitus, etc. And then they had full body x-rays, what we call orthogonal views. So every joint had 2 x-ray views taken. And the materials correlated of if you saw radiographic signs of OA, so changes within the joint on an x-ray film that was suggestive. So really, really earliest signs that they could see with an x-ray. And if the clinician had found some discomfort in that joint, that's where they got these figures from. So yeah, 8 years old, fully expected your dog to have arthritis.
Yeah. It's super sad though, and crazy for me, because I'm like, I know he's not young, but he's not old really either. And you just expect arthritis to come in much older dogs.
But spaniels, they get elbow OA pretty bad. They get a lot of spinal problems. They get really bad digital OA, don't they, Julia? Have you seen the big jazz hands?
Yeah, I have. But the ones I've seen are very specific cases of gun dogs that I feel that they've lost their integrity through the joints, the actual soft tissue in the joints, through not having enough resistance walking during the summer. And in the winter, they're walking and running over all these odd shaped sort of fields and plough and everything because they are working gun dogs. I've seen that, and we've tried to put measures in to change that. But yeah, I do see OA in feet. And they seem to be able to cope better with OA in feet than often other joints. We can't cope with OA in feet. It is so debilitating.
Yeah. And hands. I mean, I can't even imagine. And then they get foot shy, and then you need to deal with them cleaning their feet, or, dealing with the fur that can grow between their pads, and they're like, owie, my feet hurt. Just let go.
Yeah.
So what else can we be doing?
Oh, can I just tell you something today? I know it sounds so daft. I've just got to tell this because I was so excited. I clipped my dog's nails today, and they both sat there and gave me their feet to do them.
Yay!
And I was just like,
Go
do you know
on,
what?
Hannah.
I love that. So Elsie, who's the Moroccan street plonker, she watches what Luna does, and is just like, oh, I'll do what she does. And it was so cool that they just like, okay, yeah, just go on and do it. All right, do that one. Okay, I'll stand up and let you do the back ones. And it was just like clockwork, and I was just quite pleased. So there you go.
Well done, Hannah.
And that does have an involvement with OA, doesn't it, Julia?
It does. But you see, I'm going to go down the other line of things. You talk the skeleton, I talk the soft tissue. And the two obviously are married together. So a lot... Well, what we see, obviously, is the dysfunction within the soft tissue or the connective tissue. And that creates so much, either primary or secondary, discomfort/pain. And we know that because once we've worked on a dog with diagnosed OA, they are better, they move better, their comfort is better. Their whole behavior is completely different. So
amazing.
It is combining the two. We are quite the soft tissue, the muscular side of things gets a really is the poor relation, whereas really it should be looked at with a much higher regard because it has total influence over the dog's body, total, and it can create such levels of pain and discomfort that maybe they think it's coming purely from the joints, but it's coming from both. And to create a more balanced, symmetrical dog, however balanced, to the point where you can get them as balanced as possible, is going to equal the load. I'm going to just use an example here, and it rather shocked me. But a year or two ago, I had a really bad accident and I was wheeled off to hospital and I was x-rayed from here and my pelvis. I actually had a pubic fissure. I actually broke my pelvis slightly broke it.
Sweetheart.
Can you slightly break your pelvis?
I did. Anyway, was this in any way horse related, Julia? Just out of interest. Maybe.
Possibly. It was a flying lesson that went wrong.
Right, cool.
Yeah. It was actually a bad one. I've been very, very lucky.
Mm.
I tend to be quite sticky, but this one was quite exceptional. Anyway, the thing was that they x-rayed me at the hospital,
Mm-hmm.
and I was pretty broken when I was there. And then I was called in to be discussed after. Now, I've got a full-on scoliosis. I've got a very, very very pronounced curvature of my back, which I very generously gave it to my son too, because I think, that's
kind.
the general thing to do.
Mm-hmm.
So I got this scoliosis, and so I went in, and funnily enough, it was actually a consultant that looked at my X-ray, and she went, "Oh, I think I got the wrong person. This isn't you." I said, "Why?" She said, "Your posture's too good."
Wow.
And I said, "Oh." I said, "No, that's me. I know that's the shape of my back." And I work really hard on maintaining as much integrity within my body as possible. But then the real shocker came when she looked at my pelvis, and then she looked at my hips, and she said, "God, you've got bad arthritis in your right hip." I went, "What? Really?" And she went, "Yeah, really bad." "Oh, no, it can't be that bad." She went, "No, it's really bad." I said, "Well, I don't want to hear anymore."
Yeah.
I've never felt, and I'm not saying that arthritis isn't painful. I'm not saying any of this. For me, I've never felt that pain. I feel pain in my neck.
Mm-hmm.
I get lots of bad headaches and postural problems with my neck.
Interesting.
But not that hip. And I'm hoping that is because I work very hard on maintaining my posture. Very hard. I have to. I can't not, because I just would collapse like a pile of cards. So, for instance, I fell over. I didn't have a fall, Hannah. I fell over the other day, because having a fall is when you're old. But I fell over.
Or drunk.
Or drunk. Neither. I did fall over. And I know if I do something like that, and this is where I am at the moment, so I've got to rebuild myself. So I know it is difficult to maintain that integrity, but the importance of soft tissue and balancing and symmetrical muscles and stability within the body is really important to maintain that body, whether there's a diagnosis of OA or whatever it might be. The soft tissue is so important and often disregarded in injury and accidents. An X-ray may be done and, "Oh, no, they're fine, off you go, and just reduce the exercise for a couple of weeks, and then off you go." The damaged tissue needs to be repaired like a bone. So that's our passion, and that's where we come, and that's why it works so well with OA, because you balance the dog outside and in.
So what would be like a good treatment program if you were going to, let's have you both work together? I've got and you've got this dog, and he, let's just use mine as an example, but it could be any dog. It's a normal thing for a spaniel to have at 8. What would you do as a combined approach to treat arthritis and a little bit of hip dysplasia, because I think that comes with a lot of dogs too? What would be that course?
We've got something that we say, and the condition belongs to the vet, and the effects of the condition we treat. And I think that is. Do you agree with that, Hannah?
So yeah, it's a legal requirement. The only people that are allowed to comment on a clinical condition and diagnose it and prescribe for it is a veterinarian. So there's a legally binding kind of contract that exists. And in an ideal situation, that caregiver would feel confident enough to, first port of call would be the vet, ideally. Is that
we
established?
We only work under veterinary consent anyway, so
yeah,
that would be the case.
But I think the ideal would be for a normal kind of route, that caregiver notices something's not right, they go to the veterinarian. The veterinarian's very open-minded to the fact that pain can present in all different kind of domains. So it could be behaviorally, physically, physiologically. They're very alerted to it. They then score said pain and decide whether it needs medical attention. So talking about more than likely a pharmaceutical intervention, because welfare is paramount, and it's one of the quickest ways to control what we call inflammatory pain. Whether people like it, we're thinking about what the dogs want. I'm sore, please make it go away in 24 to 36 hours. Please help me. But then what would be ideal is for the veterinarian, whilst pursuing maybe a diagnosis, that would be what we're obliged to do. We should say, I feel that there's discomfort, both hips. I suspect there's hip dysplasia leading to secondary osteoarthritis. It would be in our interest to get a radiograph done to confirm my findings, so that we make sure that we're on the right treatment track and we've got the ability to prognose for the condition. So say that's happened, then what would be ideal is for the vet to use their team to offer this more multimodal approach. And it might be the vet nurses take on the weight clinic and talk about the home environment. It might be that they then outsource to a garland biotherapist who's going to be working on the soft tissue. But in an ideal world, we would work as a team from that kind of point onwards. And if you can establish that, then you've got a working relationship where Julia might have a case where somebody came in for a fitness exam and she's like, oh, I'm not happy with this, I'd like to go see a vet. Or Julia's working on a dog and she's just not getting where she wants to be because the dog's actually too uncomfortable for her to do it. So she can say, I'd really like you to go back to your vet. This is what, pain kind of score we feel, this comfort scale. I feel that me and your vet need to work together. They are going to potentially prescribe you a window of decreased pain state for me to get in and do the things that I need to do. So that's what would be lovely to happen, whether it is happening. That's why with the chronic pain symposiums, interdisciplinary, we're trying to get people to want to work together.
Come on. And that's why this podcast is called The Future of Dogs, because it's all about looking at what the future could be if we, we are all trying to do our absolute best. But as per usual, we've got two amazing game changers who are coming up with something. Not only is it a topic of conversation that people just aren't, it's new. Talking about pain in animals in an honest and open way, taking the shame off pain and really bringing these conversations to the fore is something that you have both been doing for so long. And most importantly, this lovely combination of professionals shaking hands and saying, fair play, you do a bit that I don't do. And it is so important, crucially important in being able to give the dog, a holistic approach to health and welfare for the future.
It requires a lot of trust and respect, really. And let's deal with respect first. I'm just going to use OA, just because arthritis, because it's my favourite topic. And I've been obsessed for years and I still don't know half of what I need to know. Like, I don't know a quarter, an eighth, There is so much to know about this one bloody disease. I'm never going to know it all. So I've got to work with people. I've got to respect that my knowledge is this in certain areas and their knowledge will be that. And so respect is really paramount for people to work together, but also trust. And to know that the person that you're working with has got your back as much as you've got theirs, that you have a common goal, that it's about the dog, and the caregiver. Great communication, which is never prioritised because everybody's just so blinking busy now, isn't it? People write reports, they don't get read, they don't arrive, reports don't get written. So there's like some really big core elements to make this teamwork approach, this team approach work, which need to be prioritised, but they're probably not being prioritised at the moment.
It's hard. There is a lot going on.
Yeah. And I think you're right. It does come down to, there are lots of other political reasons, but, time, money, all those things. But I think the biggest one that you said there, Hannah, is respect. And people have got to respect that other people have areas of expertise. It may be a very small window, or not a window, but a small amount, but very targeted area of expertise that really is a vital piece of that puzzle. And I think that's something, and obviously I'm speaking from my perspective here, because trying to get that respect for soft tissue and the myofascial system of the dog is really, really important. And it's something I've been shouting about for so long. People get fed up with me shouting about it, but it is so very, very important because, you've got to be the dog's advocate on these things.
100%.
And I think, too, having this incredibly wonky body of mine has been the best thing I could have had. Oh. I'm really grateful for it because it's also given me the empathy of how important and how much discomfort and how it affects my every thought of how I do things, how I perceive things when you've got that level of nagging pain, whatever it is. Mm-hmm. And then the feeling of when it's gone, you may not look very different, but that interoception and that whole physical confidence is on a different level. And understanding that helps us, I think, and it's helped me understand that, as you were saying, there's no cure often, but there's management. And it's knowing when you've got to that point where you go, do you know what? That dog has improved by X%. They've picked up a toy. They haven't picked up a toy for 3 years.
Yeah, wow.
Or they've lifted their head, or their tail is looking more natural and they're using it in a natural way because their back feels better. That is gold. And that is so important. And it's understanding what those differences are going to feel like for that dog is just, So, I'm very grateful for my wonky body.
And, it's the same in behaviour and training spheres. As soon as we started talking about pain really and communicating about how many dogs are likely to be in pain, and we do start seeing it now, it's like actually almost every client that I work with, not that they don't, that most of them come via veterinary referral, and if they don't, they immediately get sent to the vet because I need to still make sure that that's been looked at before I do any behavioural work. But for the majority, I'm like, you have a pain condition and you are biting people or getting really grumpy or guarding your toys or whatever it is because you're in pain. There is a physiological reason why you're in pain. Obviously, emotional pain is painful too, but there's so many that I can see that I'm like, I'm pretty sure I'm not a vet. You need to go and check with your vet, but I think you've got an underlying pain condition, and that is just making a bad situation so much worse. And you're both of you so right, Of course we can manage, but if we can prevent by doing obvious things like breeding healthy dogs and putting some carpet down and not taking our dogs to skate parks.
Oh, stop it.
It's true though, Hannah. I'm talking to myself, not Hannah Capon. You need to learn. This is it. It's just a little bit of common sense and loving our dogs well in those environments and thinking about, Dachshunds jumping off. So the amount of Dachshunds I've seen jump off the back of sofas, and I'm like, I can't even watch you do that one more time. It's just gonna. We just need to think about what they're capable of doing, and again, books like yours, Julia, understanding anatomy deeply, like how to build a puppy really well, like understanding how they land, how they jump, how they're supposed to move, how they're not supposed to move, super important. And it is going to change the future. I know it. Hannah, why haven't I got your book? That's what I want to know. I've got Julia's book.
The only book that I've got published at the moment is Why Don't You Listen, which is the children's book. Which, great story.
It's a hard read, that's like
it's tough.
Tome. It's a tome. It's like War and Peace.
It really is.
A thick children's book. That's the way we like them.
Yeah. No, I messed up a visa. Do you remember this, Julia? I was in Moscow and I messed up my visa and I wasn't allowed to leave. So I sat and cried in an airport in Moscow.
Almost worked. I almost got through.
Back to Russia.
I know. So I was sat in this Moscow airport for like 24 hours waiting for the ambassador to say, yes, she can go back to England. So I ended up writing a children's book about I wanted the family to learn. I just perceived that in the 1950s, people used to read to their kids. I don't know if they do so anymore, but I just had this concept that a mother, a father would see a book about preventing dog bites and think, actually, that's quite important. And then they would bring it home, they'd read it to their kids, and it would educate them as well. Because us adults, we think we know everything. We really don't. And I know that I was trying to actually get to the adult as much as I was trying to get to the child. And a lot of adults are just like, I know everything I need to know. But by them reading the book to their child, it was going to educate them as well.
Smart.
And then I got this amazing guy, and this is quite a common story for you, Cam. We'd helped him with his dog, and he then illustrated the book for free, and it's beautiful. It's beautiful. It's been published over in China.
That's amazing.
Which is quite cool. So Nanon, which is a drug company over there, we said, we'd love to see it circulating around the world. So anybody listening who thinks, actually, I'm in the position to do that, we want to license it out to organisations, to companies that will get it circulating. But I'm currently working on a book with the legendary Dr. Kristen Kirkby-Shaw, who is like my really clever older sister. I thought you were going to say
Julia Robertson then.
Yeah, we kind of keep talking about it, but we haven't got anywhere yet. We will. We'll just have to both lock ourselves in cupboards.
I'm doing about 3 lines.
Oh, yeah.
You're both changing the world, ultimately, all the time. And I know it takes up a lot of time, doesn't it? Yeah.
Yeah, well, so she set up an organisation called CARE at the same time as I started CAM. We didn't know about each other at all. Now, she's double board certified, so she's phenomenally intelligent, like
Super
scary.
Smart. Remembers
so
all
whilst
the things.
I was drinking
Terrifying.
and kite surfing, she was studying.
It's a different kind of learning, Hannah.
It's a very different kind of learning.
It's important too.
I have the social kind of certificate.
Yes, that's rare in a lot of veterinary worlds. Rare. So actually,
but what was really fascinating is that we've both been on a very similar journey, and she set up CARE. And she invested a lot of money. So she was working as a vet, as a double board certified specialist. But all of her lecture, like on the side, all the lecturing that she did, she took all that money, put it in a pot to build this website. So it's quite a lot of similarities, of both giving up a lot to make it happen. And she was a lot more business minded at the beginning. So she was going to do a subscription for vets and a subscription for caregivers. But we actually got in touch when she realised that whole thing was flawed, because people still didn't care at that point enough to part with cash kind of thing. So vets weren't keen to do the subscription, because why would you want to spend $200 a year on just arthritis learning? And caregivers weren't really keen to spend $9 a month on access to all of this information and tools. So we ended up kind of sobbing over a Zoom call with a cup of tea of why is this so difficult? But so we've clubbed together and we're writing a tome. It's massive.
Very exciting. That is very exciting. Okay, so the future I will have your book. That's the answer to that. I'm very pleased to hear it, Hannah. I don't think there's any two more deserving to have their books published and sent around the world and spoken about all over the place. I'm going to let you both go, ladies. I'm sad to do that, but you have given us so much amazing knowledge and inspiration, and there's been highs and lows, and for sure, like, there's dark moments, but it's only by us looking at some of these dark moments that we are able to see the light at the end of the tunnel and actually change the future. So I'm just really grateful on behalf of all of our listeners that both of you continue to press into the difficult stuff and go, I'm not going to shut up until you can hear me.
Well, you too, Hannah. You too.
Thanks. And I wonder, actually, if you could finish by answering the question that we ask all of our guests, which is their big why or what if question that could change the future of dogs. So I don't know who'd like to go first, but the floor is yours, ladies.
Okay. Anna, do you want to go?
I'm not really sure I know what the question is yet. So you go first and I might get a glimpse.
Well, what if, isn't it?
Yeah.
Is that right? Yeah. Well, my what if is, what if good citizen, the dogs, became good guardian, and the training was reversed, and it was put more on a guardian to have foundational knowledge of how to look after a dog. And then started thinking about that, and we went crazy with thoughts and ideas and everything else, which I would love to have a discussion at some stage, but that is our thing. Because my first thing is, what if dogs could drive? That would be great. But then I became a bit more...
What if dogs could cook? That would be crazy.
It's more about choosing which vet they went to, choosing which therapy they went to, all of that. But I thought, no, that might not be quite... So what if good guardian? And then also you can have different levels and all sorts of things. Because I think if people just had some foundational knowledge of how to look after a dog, even before, like you were saying, Hannah, choosing a dog. But then once you've got your dog, to learn a little bit, just a small amount, for a start, put carpeting down in your house, that would save so much. And it would also, I hate to bring it down to money, but it would save them money too.
Yep.
It would save everyone.
That's great, Julia.
That's mine.
I'm going to go for one that's really rapidly achievable, actually. What if in puppy socialization, these puppy classes, we included a module about pain?
Amazing.
So if we actually, when, let's be honest, caregivers will come to me with their brand new puppy and they'll be like, what's the best harness? What's the best food? Where can I get the best bed? And I'm like, what's the best thing for your dog? The best thing for your dog is you learning to be the first person to notice a problem. And one of the problems that your dog will face inevitably for its life will be some form of pain. So let's make sure that that's included in the syllabus with puppy socialization.
So good. So good. So doable. Absolutely.
So doable.
As is teaching dogs to drive.
We could wang that out in no time.
Wang it. Let's.
Lots of wanging.
Let's wang
Lots
it.
of
Wang a
wanging.
welly. Wang
Can we
some
use those
pain.
little pink ones for that?
No.
Yes.
Wang it
We can wang it with a little
good
pink
use.
one.
A
Wang
good
those
My
in the bin.
God, how awful does it? Let's wang it with a little pink one.
From the pet shop.
Descended into absolute chaos as per usual.
Absolutely.
All of the best
You're
ones
lucky that
do.
we behaved ourselves for an hour and a half.
I think you
I know.
have been very well behaved. I'm impressed. I saw you pre-recording, so thank you, ladies. It's been wonderful. We haven't even been drinking, folks. It's just been really nice. Yet next time.
Next time.
Ladies, thank you so much for joining us for another episode of The Future of Dogs. How can we stay in touch with you, most importantly, before we go?
You can follow Canine Arthritis Management. So if you want to kind of get into the world of CAM, just go to caninearthritis.co.uk and you will find our education centre, our shop, our socials, join the newsletter, loads going on.
Super.
Same. The website's the best, garlandmeyertherapy.com, and you can leave a message through chat or just, that's probably the best way. Lots of ways to contact there.
And worth it. So go and check both of those out. Make sure that you can become the best dog guardian you could possibly be. And from all of us at The Future of Dogs, it's been an absolute pleasure.
Thank you.
Thank you very much for having us.
Yeah, thank you. Bye-bye.
And that's all for another episode of The Future of Dogs. Big thanks to our sponsor, Amplified Behaviour. Your host and producer is Hannah Malloy. Technical direction, audio and video producer is Mark Goslett. And the graphic designer is James Whipps.